DocTalk Live. I got quite an audience here. I wish I had this many people on Facebook Live that were actually watching this thing. But I wanted to discuss education. You know, usually on DocTalk Live I do patient education. And today we're going to do a little physician training, and I wanted to share the physician training with y'all. We're going to do some procedures today on this really cool model. Typically, in the past, we would have to fly to various places like Memphis or New Orleans or Tampa where they have cadaver courses. And we would practice on dead bodies in order to hone our craft, to do various procedures. And BioTras has been kind enough to let us use one of their models today that they basically encased in silicone. So now not only can we do the procedure under fluoro, maybe you can hit that button, yeah. Not only can we do the procedure under fluoro, but then we can look at what we're doing and see what we're doing on the model. So the problem for doctors in learning this stuff is that basically we have a three-dimensional body part, but we only have one-dimensional images. And so we don't get that 3D look at things. And so having models like this to practice on help us. Now, I want to talk to you, Jennifer, about specifically facet pain as it relates to procedures. So when folks go to the chiropractor and they get manipulated, it's those facet joints or zygapophyseal joints that you hear pop. And it is one of the more common causes of back pain, is pain coming from the facet joints. So if folks are watching this, please feel free to type in questions about back pain. If there's a particular procedure you want to see today, like an epidural or a nerve block or anything like that, you know, perhaps we can demonstrate it. But as far as the facet goes, the facet is actually kind of a complicated structure to get into. Seth, this needle right here represents the needle actually going into the facet joint. You do not see the facet joint real well on that view, but you can bring the joint out by getting what's called the Scotty dog view. So if we take the C-arm and we oblique it, let's say 20 degrees toward me, yep, and shoot that, that is showing how the needle is going right into the joint. Let's go a little bit further. Good. And shoot it. That's right. And now telescope. Yep. Okay, so now the needle, you can see the needle has gone into the joint. Okay? And so it's that sort of cattywampus view, if you will, that helps bring that target out. Now, this joint is innervated by a nerve just at the level of that joint. That's this needle here. But there's also a nerve called the medial branch here that innervates the joint. So I'm going to get another needle out. Sorry, y'all. Should have done that before. But then I can also demonstrate really the technique. We take our needle. We like to put a little bend on the needle. It gives us a level of control. So we put a little bend. Okay. So this is called the pedicle. On live, off. Right there is the pedicle, and that is the same target we will have for a kyphoplasty or a vertebroplasty. On. So I'm going to put the needle down on that bone, on right into that eye. Okay? So there is a nerve there. On. There is a nerve. This nerve here and this nerve here innervate that joint. Save that, put it on the right. Now let's roll back to you. Good. On. Good deal. So you see a needle in the joint here. That's the needle in the facet joint. You no longer see the facet joint because this is a different view. Right? A little bit more. I want to get the spinous processes in the middle. Good. Perfect. Now roll the C-arm toward you a little bit. Telescope toward you. Or away from me.
Other way.
Nope, other way. Oop. Okay, so that's good. So needle in the facet. This needle is on the medial branch. This needle is on the medial branch. So the medial branch is the nerve that innervates the facet. And now we can look at the model and we can see, okay, that needle is going right into the joint. And we can see this needle is right on top of the nerve. And this needle is right on top of the nerve. Okay? When we inject the nerve with anesthetic, we want to put the tip of the needle directly on the nerve. But when we burn the nerve with radiofrequency, with heat, we want to lay the needle shaft parallel to the nerve, not perpendicular. And that is what's represented by this needle here. Okay, if you see this needle is kind of laying along this nerve, that is this needle here. So to bring that out, what I'd like you to do is oblique toward me again. Save that, put it on the right. Okay, and shoot it again. A little bit again. Okay, again. Perfect. So here you see actually the shaft of the needle, and that is where the nerve goes. So if we look in here in the model, you should see that laying along the bone, not perpendicular to the bone. You follow me?
Yes.
Are there any questions there, Seth?
Right now, not yet. We have people watching.
Okay, very good. So that's the gist of the techniques of facet injection.
Something that, so you were explaining that you have two facets there, or two nerves, I should say. So you would burn both those nerves.
That's correct. So for this facet joint, if you wanted to take away the innervation, if you wanted to destroy the nerve, you would burn this nerve here, and you would burn this nerve here. Okay? These two needles are really blocking needles. This would be the RF needle, and this is a needle that's actually in the joint. So you wouldn't do all of this. You would just lay the needles along the nerves and burn. Okay? But to get to that point, you might want to inject the joint and see how it would respond to the anesthetic. Max, you had a question earlier that I had you hold. So go ahead, what was it?
My question was, if you take just the most cephalad needle, is it up against the superior articular process?
This needle here.
Or either one?
So this needle that's in the facet is actually wedged between the superior articular process and the inferior articular process.
I'm sorry, I meant the one, not this one, but this one that's intended to...
Okay, so this one that's on the medial branch is basically at the junction of the pedicle, transverse process, and superior articular process. So it's at that junction. And you can see it better on this image here. So what I would have to do to make it a little bit more clear is maybe remove some needles. So I'm going to take this needle out. I'm going to take the needle that's in the facet out. On. Shoot that. Trip. Okay, now come back to the AP. Good. Okay, I'm sorry. So anyway, if you look at this again, Max, there's transverse process, there's pedicle, There's superior articular process. It's basically at the junction of those three bones. And if you look in the model, so this is what's cool about the model. Now you can actually look and see where it is in 3D. You follow me? Let's lift this up. Or what if we shine a light on it?
That does help.
Yeah. Oh, yeah. Yes. No, that makes it much more clear. That's
Okay. So it's at the junction of transverse process, superior articular process, transverse process, and pedicle. Okay? So, again, if we're doing medial branch blocks, we're going to come down onto the junction of that area. If we're doing the facet, we want to go into the joint itself. Okay?
Okay.
Now you can take this needle that's in the joint and you can actually wiggle it into the central canal. And you would. This is something you cannot see on the bones because it's covering it up. But on X-ray, you could see what you can't see on X-ray. You follow me?
Sure.
All right. Anything? We good?
We're good.
Any questions?
We're watching. They're watching. No question, Jeff.
You want to just show transforaminal or something like
Let's
that?
do that. Let's do that.
Cool, cool.
So, Trip, will you just tilt toward me? Great. On. So, Jennifer, I like to call this the universal injection view. So, on this view, you now see the facet joint. You see the needle on the medial branch. If you want to do a nerve block, you would put the needle underneath the pedicle. So let's get Arash in here. Arash. So Arash is our medical student. And we're going to do a transforaminal epidural. So we're going to go underneath the pedicle. Let's come south. So you yell, Arash, yep. On live. Right about right there. Off. You just stick the needle, follow the beam, okay? And don't go too deep. Remember, just get a purchase. Back it up so you're already too deep. It's going to be on that beam. Still too deep. And he doesn't have to wear gloves. I mean, this is really a clean model on. Perfect. So the needle needs to go up a little bit, so docking notch to the feet. Good. And push. Perfect. Nice. Keep going. Keep going. Nice. Now docking notch toward you, so it tends to go medial. Good. Perfect. Now go to bone. Okay, so what bone are you hitting? So there's two ways of knowing. One, you can look, but on X-ray you need more views. So let's save that, put it on the right. Now let's go AP. Good. Okay. And so spinous process is in the middle on. Okay, so this needle is either hitting the pedicle, the bottom part of the transverse process, or the back of the vertebrae. Those are the three possibilities, Raj. So in order to figure that out, we need a lateral. We need to know our depth. So let's go lateral. Let's save that, put it on the right. So it's not hitting the back of the vertebral body. You see that? So it's probably hitting either the pedicle or the transverse process. So you need to turn the docking notch to the head, traction to the head, see if it'll slide down. Perfect. There you go. And you should see it go in now. On. There you go. Now turn the docking notch back to the feet so we stay under that pedicle. Good. And now go down again. Docking notch to the head. Slide down. Perfect. Nice. And that's it. So you're in the back of the vertebral body. Okay. And we can go maybe a little deeper. On. Okay. So we're right up against the back of the vertebral body. Okay. That's super. Okay. So save that. Put it on the right. Let's go AP.
Get my keys.
So again, this needle's in the facet itself, and this needle was this needle was on the medial branch, so we didn't get our lateral on the right boss.
Okay.
Yeah. And this is way too medial, so we're gonna back this out, shoot it again. This is where we want to be on. Good. Save that, put it on the right, let's check a lateral again. Any questions there, Seth?
Not yet.
Okay. So we're good. Okay, so this is really as deep as we want to go.
From this view, you identify or point out some of the structures that we're looking at, transfemoral, or the
Okay.
aerospace.
So the root canal is here, and we're basically in the superior aspect of the root canal. The needle that is on the medial branch is basically behind the root canal. And we took the needle out that was coming in from low to high. This needle is in the facet joint, also behind the root canal. And then this is the disc space, okay, which also we could go into with a separate needle. So that would be a separate procedure. We could also go into the vertebral body through the pedicle. That would be a kyphoplasty. All right. Why don't we stop it there? What do you think, Seth?
It's
Is that
good.
All right. And then if folks write in, maybe we can check it, and maybe if they want to see something.
Part 2.
Pardon me?
Like a part 2.
Yeah, exactly. Like a part 2. All right. That's great. Let's stop it there.